Hello, my name is Irfan Hasan and I am Deputy Vice President for Grants at the New York Community Trust. I've been at the Trust since 2000, where I joined as a program officer. I live in Brooklyn and consider New York home, although over the years I have lived on 3 continents and in 5 cities. One of the areas I oversee is the Trust's Health and Behavioral Health Grantmaking program. Our goals for this program are to promote an equitable, patient-focused, cost-effective health and behavioral health care delivery system. Our focus is on 4 broad areas. First, we endeavor to advocate for successful healthcare reform implementation by ensuring a strong and viable safety net that can provide comprehensive and coordinated care for low-income New Yorkers, as well as for those who remain uninsured or underinsured. Second, we seek to build the capacity of health, behavioral health, and human service sectors through effective skills training for professional and paraprofessional workforces and strengthening financial and information technology systems to aid in the transition to value-based payments. Third, we push for reductions in health disparities between low and higher income neighborhoods. We do this through grants to improve indoor and outdoor air quality, increase usable open space, and promote access to affordable, healthy food, as well as physical activity. Finally, we foster the independence of people with mental illness and substance use histories by expanding clinical care and practical services, especially for participant-led or informed efforts. You can see these guidelines and the accompanying background paper on our website under the What the Trust Funds section. There are 3 points to keep in mind as you think about applying to the Trust. Generally, projects that are funded usually adhere to one or more of the following areas, and these are applicable to our grant making across the board, regardless of the issue or the sector. First, will the project advance systemic change? Is there potential for government funding and/or policy change in the future? Or are there lessons for other service providers? Second, does it affect the sector broadly? Examples include advancing an innovative and promising program, expansion or replication sector-wide, or gathering data to build proof of a program's value. And third, does it incorporate proven practices? For example, will it test promising approaches in a new neighborhood, a different population, etc.? Note that we support both advocacy and lobbying, and this includes grassroots and direct lobbying. But advocacy and lobbying must be for a specific effort. And finally, we generally do not support projects that support a small number of people at a single site, one-off events, conferences, or efforts to build the internal capacity of a single agency without broader impact for the field.
Hello, my name is Rachel Pardoe. I've been a Trust Program Officer for 7 years. I live with my family in Queens, and I'm a mom of 2 daughters. I oversee the Older Adult and People with Disability program area. Our grant making is dictated by a coordinated strategy that reflects the common challenges and opportunities for these groups. Because we are a community foundation, we operate using a diverse pool of funds of differing sizes and purposes. The funds I work with are targeted to 4 groups: older adults, people with blindness and visual disabilities, people with intellectual and developmental disabilities, and children and youth with disabilities. Our strategy is separated into 3 guiding principles. We are focused on making under-resourced communities in New York City accessible, welcoming, and inclusive for all older adults and people with disabilities, and especially those groups I listed. We work with community nonprofits to make sure their programming is accessible and welcoming. And we also support advocacy projects to make sure the laws and protections for older adults and people with disabilities are implemented fully and effectively. We support strategies that help older adults and people with disabilities lead full, healthy, productive lives. These projects can include expansions or replications of innovative educational, vocational, and training programs. We also support research and pilot programs to test new approaches and those that use technology and other strategies to help older adults and people with disabilities remain as independent as possible. And we support efforts to help families and caregivers. Lastly, we focus on efforts to ensure the workforce is effectively trained and has promising career opportunities. We are also interested in helping agencies create appropriate financial and management systems and develop partnerships to glean funding from Medicaid, Medicare, and other sustainable sources. If you'd like to see the full 50-page strategy, it's on our website. Our program officers often work together, but it's not up to the applicant to determine which area to apply to. We assign new proposals on a weekly basis. There is no need to speak with a program officer before applying, and we accept proposals year-round. We urge you to review the other informational videos on our website and look out for occasional webinars introducing the Trust and its program officers.